That's stop everyone.
Okay.
Hello, can you hear me yet? So it's my pleasure to introduce our next speaker, Gill Vance. Gillian is a professor of medical education at Newcastle University and also the co-lead of the NIHR Clinical Education Incubator. Very relevant for this session that Gillian is kindly joining us with. So over to you, Gillian. Do have a look at the Slido and please submit your anonymous questions and we'll come to those at the end.
Thanks very much indeed. Thank you, Kath. Thank you, Katie, for the kind invitation to present today. Thank you, audience, for attending, and to the huge numbers of online people for listening to the talk. It's my pleasure to present an overview of the NIHR Clinical Education Incubator, what it is, how it can support you, and how you can get involved. Okay, so firstly, what are NIHR incubators? The incubator programme fell out of the 2017 NIHR Strategic Review of Training, And their goal is to support capacity building and multidisciplinary career development in areas of strategic need. Each incubator has a bespoke programme that's targeted to the specific needs of the particular area. And the aim is to encourage interest, support career progression, and build identifiable communities. The Incubator for Clinical Education Research was awarded in the first competition in 2020 and has recently been renewed at the end of 23 in the second competition. There are now 10 incubators across a wide range of areas. So to give you a couple of examples, these include applied health and care research methodology, community rehabilitation, diagnostic and therapeutic radiographers, emergency care. So there's a wide range of different areas. But why this incubator? And there are two reasons. The first is that clinical education is a priority area of research. We are living in a fast-changing health and care landscape with an aging populations, changing patterns of health and disease, new technologies, therapeutic advances, changing models of health and care delivery. And in this context, research into and informing these changing needs and delivery of education and training is essential to promote a safe, sustainable, and effective NHS and social care. Because our research outputs can anticipate and solve practice challenges, supporting implementation of innovation. Yet, despite the potential impact of clinical education research, there is a significant need to grow and develop the community. These data illustrate that point. So the data are taken from NIHR between 2006 and 2020, and the current data are being worked on by NIHR. So these are a little bit out of date. And they show fellowships funded by NIHR Academy, other NIHR infrastructure, and NIHR senior investigators. And really, the point is simple, is that clinical education is significantly underrepresented. Only 62 of over 3,000 fellowships, that's 2%, mapped to the area of clinical education. And mostly these were in medical specialties. So by establishing an incubator, we want to create a space for dedicated researchers in clinical education who are distinct from but complementary to other educational roles. We want to create a position where educational research sits alongside and has the same standing as clinical research. And in so doing, that is a key step to advancing the discipline. Now, what do we mean by clinical education research? This is the incubator definition, and it's quite a broad-ranging definition. And the aim was to promote inclusivity, to make sure that researchers who lacked a home can come into the space that we wish to create. And to point out that it was a very definite activity to place the health and care needs of patients and public at the heart of our definition, because we know that the outputs of clinical education research will benefit society. We know that, but this definition makes it explicit. So to develop that a little bit further, what might fall under that broad umbrella? And these are some examples of research that might fall into our scope. So research that's around getting the right people into health and care professions, ensuring that they learn effectively, that they develop appropriate professional values, that they are confident, competent and safe. Also research that's around making sure the workforce has fair and equality of opportunities, and a workforce that is supported so that they may be sustained to carry out the work effectively. Now, in order to plan a targeted, effective programme of support, we need to know what the underlying barriers would be to career progression specific to clinical education research. And so to understand and address those issues, we carried out a piece of research in the incubator, which was led by a number of early career researchers. And we carried out 6 focus groups with doctors, dentists, nurses, midwives, and allied health professionals. And the data identified 2 main categories of barrier. The first is around cultural challenges, how clinical education research is understood and perceived by the wider communities, as well as systemic challenges. And I think core and fundamental to the cultural challenges were an issue of how clinical education research lacked esteem compared to other clinical research communities. And the first quote, I think, really sums that up quite nicely. I think neurologists tend to see medical education as being something, not really, well, like a kind of a fake science. In relation to the judgments, these were wrapped up in issues around perceptions of a lack of funding for clinical education research and a length of time or an indirect benefit for patients. In the data, there was also frustration among participants that clinical education lacked a distinctiveness, that it was poorly recognised within the education community as well as without the education community, where when I tell people I want to do medical education, they think, oh, you want to teach, and that's it. Full stop, you teach. In relation to systemic challenges, there are perceptions of an ill-defined career track, that career progression is unpredictable and serendipitous. Indeed, one referred to the career space as being a sort of a jungle that you have to hack your own path through and try to find a route that suits you. There was also a lack of relevant skills and training opportunities, being mindful of the very typical traditional way of learning in health professions education. And so there was a lack of confidence and competence within the relevant skills needed, and a poor accessibility of the training opportunities. Noting that the language of clinical education, the terms, their understanding and their methodologies all feel very different. So with this background, what we are doing in the incubator is carrying out a host of work to improve the accessibility of clinical education research. We want to make those existing opportunities more visible, and we're working with system leaders to promote clinical education research in untapped structured training posts and programs. In relation to training, we host training events for all stages of the career pipeline, from those that may be totally naive to clinical education research, you want to develop core research skills, right through to those that may be in a doctoral or postdoctoral stage who are taking on new supervisory roles and want to further their career. And just to give you a few examples, these are a set of the seminars that were delivered as part of the Getting Started In for entry-level researchers. There's a range of topics from coming up with an idea and writing a research question through to planning your career. I think what's key here is that these topics and indeed delivery of the programme were jointly delivered with an established researcher and with an early career researcher, because a key ethos of the incubator is that we wish to develop researchers as part of our programme of activities. And these are examples of the range of topics that were posted in our faculty development programme for new supervisors. Again, these are topics which are critical for those that have been identified as critical and perhaps difficult areas specific to clinical education, such as leading supervisory teams, including across multiple research paradigms, the use of optimizing equity, diversity and inclusivity in educational research and supervision. My thanks to Nicola Brennan, who is leading that programme. We're also supporting you by generating a set of resources. We've got a host of different resources available, including a book chapter, which has a chapter dedicated to developing careers in clinical education research. And that was a chapter I wrote alongside a dentist, alongside a postdoctoral doctor, and alongside a nurse academic. We have a whole series of how-to articles, including those that relate to undergraduate students, those that relate to entry into the field of clinical education, about growing a team, about securing funding, about supporting others. And noting my point earlier about the difficult language that can sometimes be a barrier, we also have a lexicon and a how-to guide written by Gab Spin and colleagues, how to define clinical research terminology, a glossary, again, trying to reduce barriers and improve accessibility of the space. One of the key goals of the incubator is to maximise the impact of clinical education and also to reshape the cultural environment that we're working in. And to consider this issue, we held a knowledge exchange with stakeholders in the last year or so, where these stakeholders included researchers, policymakers, funders, and patients. And in that exercise, we reviewed Adelphi findings around priorities for research. I think we'd hoped to set national priorities for research, but we didn't leave with a top 10 list, but rather we left with a better understanding of the principles and that are needed to prioritise, and also with a clear understanding that priority setting needs to be a dynamic, ongoing process that's responsive to the needs of the wider context and to the needs of the relevant stakeholders. In that event, we had conversations about what is needed to optimise and build research impact, who needs to be there, and what is required for that to happen. The session also led directly to a funding call for educational research hosted by NIHR Health Services Delivery Research Workstream. So in summary, the incubator is supporting you, or can support you, by enabling connections between peers and junior researchers and more established researchers, and between stakeholders in the research space. Our activities are seeking to overcome those barriers that are cultural and practical. We're building a critical mass of individuals working in clinical education research and generating a sense of belonging. Through the activities I've mentioned, we've had really powerful, really productive, really constructive collaborations. The incubator is supported by a number of leaders in clinical education, many of whom are in the room at the moment, but we also feel very strongly that through our activities, we will be developing the future leaders in clinical education research. Our activities are underpinned by the research informing what is needed in clinical education research, but our outputs or our elements, evidence would suggest that these are the factors and the mechanisms that can lead to a successful research environment. So as I said at the beginning, we are now moving into Incubator 2, the next phase, which started in January 23. This will be led by a new leadership, including Sophie, including Dr. Megan Brown, who is an early career researcher, being supported by Janice Ellis, who is a professor of dental education, and Brian Burford, who is a non-clinician and researcher in medical education. And with the benefit of the activities through Inc. 1, we have clear direction of travel for Inc. 2, with now a focus on supporting entry to clinical education on particular underrepresented professional groups, especially nursing, midwifery, and allied health professionals. We've generated wide interest in clinical education research, but now we want to pull through those interested individuals into doctoral research programs. We want to encourage sustainability of clinical education research by focusing on those new supervisors and making sure they feel equipped and supported to support the next generation of researchers. In Inc. 2, we'll be supporting best practice and PPI in clinical education research, and you've just heard a little bit about that a moment ago. And lastly, we'll be considering our legacy. What do we need to do? Who needs to be in the room? How do we have a structure, a network that will allow us to sustain and progress our work, not just for a couple of years, but for decades to come, so that once and for all, clinical education is no longer the Cinderella discipline. So I hope I've motivated you to get involved in our network, but if I haven't, please do have a read of one of our quotes from one of our early career researchers, who then was a graduate doctor entering the foundation program, was one of the team involved in writing in one of our articles. Do join our network. We have a number of work streams if you want to get more actively involved, and we have a number of upcoming events, which I'm now going to plug mercilessly. The first being the Mastering the Basics Research Training event. So we hosted this a couple of years ago as a single day, and it was a super in-person interactive day, which we're now going to run over 2 days, where day 1 is for those with entry level, but day 2 are for those that are already developing an interest in clinical education research and working towards a fellowship. We'll have workshops around optimizing EDI, optimizing PPI, researcher exchange sessions on day 2, when there's an opportunity for your research to be critiqued and supported, slightly more individualized support for those progressing fellowship applications. We're hosting this event in partnership with ASME, and we're attending ASME, that's the Association for the Study of Medical Education, at their annual scientific meeting in July, where the last of our faculty development series is a workshop around building and leading large-scale programs of research. So if you're coming to ASME, come and find us. If you're not coming to ASME, do sign up and come to ASME. So thank you for listening. If you'd like to hear more, if you'd like to find out more about the incubator, our email address is at the bottom of the screen, and we'd be delighted if you became a member of the incubator family. Thank you.
Thanks so much, Gillian. That was a really interesting talk, and great to hear about all the incredible events and different resources and everything at the incubator. It's really fantastic. I think you've alluded to the top voted question, which was about incubator events surrounding networking and meeting people. So I think you've covered that on your last slide, which was brilliant. Someone has put, how do we find out about those events? I know there was a QR code there, but where's best to sort of direct people to?
Okay, so you'll be able to find it through X on the incubator website, which was the very first slide, through ASME website and at ASME, but I suppose the easiest place is to look at on Twitter/X.
Brilliant, thank you. And then we've had a question about, can the incubator put applicants in touch with potential supervisors or mentors for NIHR fellowships?
Yes, actually, that would be exactly a role of the incubator, is to offer that signposting. It's not a source of funding, but it is a place where we can signpost individuals to other academics working in that particular space. On the website, we have a directory. Directory is in evolution, but it's a place where you can look to see individuals and what their roles are. So it's a means of connecting individuals to find out who's working where and what they're doing.
Fantastic, brilliant, thank you. And then I think we've got time for one more question. So there's a question about, is the incubator doing work around research and improving clinical education programs for allied health professionals and others beyond medics and dentists?
Absolutely, absolutely. And as I'd said for Inc. 2, that's very much our focus of interest, is to broaden career development beyond medics and dentists. So if you are a member of the MMAT professions, please do come and talk to us, because we'd love to involve you in the work of the incubator. We've got quite an active work stream led by Gav Svin, and they'd only be too pleased to have those insights and that energy to the programme.
Brilliant, I think that's all the questions that we've managed to cover. So thanks very much, Gillian.